So social prescribing is growing in popularity. You might have seen lots of stuff happening in the media of late. Our new Secretary of State has been tweeting about it from Expo, which, I personally was very excited about, probably more excited than I should be about a tweet, but hey-ho. And Simon Stevens has been quite a fan of social prescribing as well, and is really looking at how we can encourage more social prescribing across the UK. And really, social prescribing is about connecting people to help them manage their health and wellbeing better. It's about building the community assets that we have and connecting people with what's already out there. So I think across all of our communities, we know that there's so much going on, so many voluntary sectors, in activities, so much really great stuff happening in our communities. And social prescribing is about how we can develop that more and connect people into it. Very much social prescribing is collaborative. What you see is local authorities, GPs, CCGs, voluntary sector organisations, primary and secondary care, all working together. It helps reduce health inequalities, and it provides support for people around a whole range of issues. So, a lot of people come in for issues around finance, money, work, housing, and a lot of wider determinants of health. Social isolation comes up a lot. Sadly, we know it's a real issue for a lot of people. But we also see people coming to social prescribing schemes who want to get linked to things that might help make their lives healthier. So, fitness, diet, access to different sort of community gardens, that sort of thing as well. And it really gives people the control. So it helps people to think about what it is that they want for their health and wellbeing, how they want to manage their health better. Now, I have a short little animation that we've made that tells you a little bit more about social prescribing.
Many things affect your health and well-being. GPs tell us that a lot of people visit them feeling isolated, lonely, or stressed out by work, money, and housing problems. These are issues that can't be fixed by doctors and medicine alone. At its most basic, a social prescription offers the kind of help that doesn't come in a tube or a bottle. The idea behind social prescribing is to help you to have more control over your healthcare and find ways to manage your needs in a way that suits you. There are lots of different ways of providing social prescribing services. It often starts with a conversation, perhaps with a link worker, a support broker, or a community navigator. Whatever they are called, they are there to listen to you and put you in touch with whatever it is you might need in order to feel better. That might mean being introduced to a community group, a new activity, or a local club. It could be legal advice, volunteers to help around the house. It might just be information and guidance, a bit of inside knowledge on your situation and what local resources there are available. It could even be some support in how to create something new. Studies show that individuals with social prescriptions get better and feel better faster than those treated with medicine alone. And because it works, it's happening more and more. To find out how it can work for you, talk to your doctor, health professional, or local authority today.
One of the questions we often get asked is, how does social prescribing differ from things like active signposting, community wellbeing hubs, that sort of stuff? And I guess most people probably have a bit of a sense of what active signposting is, and we would see that that's a really important part of a really good social prescribing scheme. So what we often see with active signposting is existing staffing practices who are trained to help people to identify various things in your communities that might help them, that might benefit them. But what active signposting probably isn't is having that really detailed one-to-one conversation with somebody, having the time and space to really explore what's the crux of the issues that people might be facing. Community wellbeing hubs, we see a lot happening now, and there's some great examples happening across London as well, which is where you actually see a GP practice working as a hub of the community. And really, I know my local practice is actually in a community hub in the library, and there's a heap of information in the library that brings people to the GP practice and gets a lot of information about what's happening in the community. And where the social prescribing connector scheme comes in, and where they're sort of different, is where you have what we tend to call a link worker or some sort of community connector who has the time to spend with the patient, to sit down with the individual, have a half-hour conversation. They can have what we see is between 6 and 8 sessions is quite common, to really look at and really spend the time exploring with the individual what else is going on in your world, aside from the things that you're coming to the doctor for. What are the things that are impacting you? What are the things that are affecting you? And what are the things happening in your community that might help you manage that better? And actually what the link workers are able to do is then to look at, a lot of the times they can help them to get advice about things like, what benefits might you be eligible for that you didn't know about? Are there some some things we can help you in terms of linking you with to someone to give some advice about employment and help you get back into the workforce? Are there some community groups that have the interests that you're kind of keen on that you could then link in with your local community? And the link workers can actually take the person down to those community groups, spend the time to properly introduce people, which I think when you're quite isolated and you're not necessarily getting out of the house very often, it can be quite nerve-wracking to start to kind of go into the community and join up with a group. So link workers and volunteers that support them will actually take people down to those groups and really connect them to make sure that they are actually getting to the places that might help them, and then following up with the individuals to say, how did that go? Did that work for you? Do you want to do some more sort of stuff like that, or do you want to do something a bit different? To really make sure that the sorts of supports that they're recommending are the things that people want and people find useful. So this is what we're looking at. We're trying to design the universal offer for social prescribing across the UK. And really what that involves is being able to enable referrals from all of these different sources into a social prescribing connector scheme, who can then connect individuals into all of the amazing things that happen in community groups. What we often find is the social prescribing connector schemes, they can be supported and funded by a range of different individuals, but what we're seeing is CCGs and local authorities quite often joint funding a social prescribing connector scheme, and they have the connection with the voluntary sector, because more often you see a link worker hosted by the voluntary sector. So you then get an individual who's really connected to the voluntary organisations in their community, but also has a connection in through the funding to the social services, through to CCGs and to the health system as well. So you do get that real connection, which I think often a lot of other schemes and signposting, for example, you don't have that real connection between health, social care and the voluntary sector. So social prescribing is really about trying to make sure that connection is there and live and working well for groups. What do the link workers do? So obviously they take referrals. At the moment, the main source of referrals are coming from GP practices, but we're also seeing people self-referring in a number of schemes, and then some of the local authority areas are referring in. Most of the social prescribing schemes, as I said, employ a link worker. We also see a lot of volunteers who support the link worker and work alongside the link worker. A really critical part of link workers and the social prescribing scheme is giving people time. I think we know that most health professionals and most people, when you see somebody within health or social care, time is really precious, and it's really hard to give people the time that they might need when their issues are a bit more in depth. It's about developing a shared plan. So kind of saying what is important to you, and how can we develop a plan for linking you with things that will work for you. A critical part of social prescribing is supporting community groups. We know that having a really vibrant voluntary sector is critical to social prescribing. We can have all the link workers we want, but if we don't have a vibrant voluntary sector, they're not going to be able to help us. So a lot of link workers spend about a third of their time talking to voluntary community groups, helping them to connect in to other sorts of support, helping to point them to where there might be funding if that's an issue for them, really helping to build up different community groups and identifying if there is a gap in the community. Often what we've seen is a lot of people who are using social prescribing schemes end up becoming volunteers themselves, and in a lot of cases have started small little community groups themselves. So the link worker can play a crucial role in supporting that. The other thing with social prescribing is that it is cost effective, which is always nice to hear. Is it working? I guess this is the key question that everyone has. So there's a growing body of evidence that social prescribing is being effective. This is a University of Westminster study that did an evidence review of a wide range of different social prescribing evaluations that have been done in the last sort of 3 to 5 years. And they found quite big stats, around 28% reduction in GP attendances and 24% less A&E attendances. But we're starting to see there's some schemes happening across London, and some really great evidence coming out of those schemes as well. So this is a study from a pilot done in East Merton. This evaluation looked at 206 patients that had been seen by social prescribing schemes, and some pretty big reductions. So 77% improvement in wellbeing as reported by the patients who were seen by a social prescribing scheme. 33% fewer GP appointments. And I think the really interesting thing with that figure is when you looked at those individuals who'd been seeing their GP the most, so one individual who had been in the 3 months prior to referral to a social prescribing scheme had seen their GP 55 times in a 3-month period, which is a lot. I don't know how you have the time, how you get an appointment 55 times in 3 months, I don't know, but they had done that. And they'd reduced their GP attendances down to 25 times after being seen by the social prescribing scheme, which I think is pretty amazing for that individual, but it must have been great as well for the practice staff to have somebody who was reducing their attendances that much. And then 50% fewer A&E visits. There's also some studies coming out of Kensington and Chelsea, all of these available on our wiki page, but you can Google them as well. Kensington and Chelsea were really keen to look at the social return on investment and using very technical, I'm not even going to try and analyse how they did it, but were able to determine a social return on investment of £2.80 per person that saw a social prescribing scheme. They also had a 11.5% reduction in hospital attendances, and over the course of that scheme, which it's now happening across all of Kensington and Chelsea, across the whole borough population. And in the first year, they'd seen 1,300 patients through their social prescribing scheme. And their scheme's actually quite interesting because they've trained a number of staff who, across most health services, to become social prescribing link workers in part of their job. So they've been given extra time as part of their role to do social prescriptions as part of their day job, which I think is quite an innovative way of doing social prescribing. And then Tower Hamlets social prescribing. So they've been doing social prescribing in Tower Hamlets for a long time. I don't know if anyone's heard of the Bromley by Bow Centre. Very well established social prescribing scheme, and highly recommend if you're interested in finding out more, go down and do a visit. They're a really great service to look at. But they have seen a 12.3% reduction in GP attendances 6 months pre a social prescribing referral and the 6 months after. And I think it's quite amazing when you think that's 418 fewer appointments that were offered across that 890 patients, which is quite a big impact on the scheme. But what I wanted to show you as well is some of the stories. I think I can tell you all about how good it is, and you might have experienced social prescribing in your own areas, but it's actually hearing from patients themselves, I think, that can make the real difference.
Actually, I was so alone and was very isolated, so I was staying at home all the time.
Being quite a tough time of late, I needed to have some help before things started to get too bad.
I hadn't been to the doctor for about 5 years, 6 years. I have agoraphobia. I'm just finding it difficult getting out.
Quite a lot of patients, due to social determinants of health, come and see their GP for non-medical related illness or problems, just because they don't know where to go. And us as GPs, we don't know what to do with them, and so we often don't give a good service.
Because it's very hard to go and see your GP and try and explain within 10 minutes what sort of problems you're having.
Because I didn't particularly want to go down the tablet form again, or the medication.
So when I discussed with my doctor, he referred me to the social prescriber.
Dr. Sikram, my GP here, when I came back to him and said, look, I'm really not coping too well, he sent the email in front of me to say, look, I'm doing it now for you.
It was like you could just talk about the things that are worrying you.
I come to know about the community centre, that there is the lunch club is going and different activity programs are going over there. So I can join them, I can make the friends, I can come out from my house.
It was just overwhelming because you thought, oh, is this available, is that available?
It was actually quite interesting that he was able to say, okay, here's this piece, and if you tap, here's another piece, if you look into there, they can help you with this side.
He named people so I could go and ask by name, you know, and he referred me on, so they would call me rather than me having to call them. And
having that support mechanism within Mitcham and the local community just made me feel like I could cope.
It's just knowing that the people are there now, which I didn't know before.
I was totally blind, honestly. I don't have any idea what's going around my community and what type of the social activities are here.
I only live behind the community centre. It's only about 2 minutes walk from my house. I didn't even know there was, people there that can help me with stuff.
And I didn't even know these services existed, even though I've lived in Merton all this time. I didn't even know there was this help out there.
I think for me that's the reason that I think social prescribing works. When you look at what the patients are saying and what the benefit can be for them, I think that's why I think social prescribing is a great idea. That's a good question. So at the moment there's a kite mark system sort of being developed, so it's not in place as yet, but it is something that's being developed. Most of the local areas will look at the vetting system that works for their area. So for example in Merton I know that the link workers will have because they have such a close connection with the different voluntary sector organisations, they will do some vetting themselves, so they will have a system. Other areas will have slightly different mechanisms, so I think it's being developed on the ground really. In certain areas it can be. So we have some GPs, Mohan, who you saw in the video, is an absolute, he loves social prescribing and taking it a long way. He's an absolute proponent for it. I think in every practice, particularly where there's a large number of GPs, there are some GPs who absolutely get it and want to refer every patient they see. Others who don't quite understand what it can offer and aren't so keen on it. But I think what we start to see is when somebody in the practice is referring people, other GPs in the practice start to see the benefit of it and will start to get on board and make referrals. Most of the schemes, and I didn't write this stat down, but most of the schemes will have the link workers based in a practice some of the week. So often what you'll find is one link worker for 4 or 5 practices, so they will spread out across the week at the different practices. There's a few areas where we know that link workers are based in a hub and they will get referrals in from the GP, or they might do a couple of sessions of outreach in the GP practices. But actually where we see it is most effective is where they do have time in the GP practice. And actually a lot of the schemes, the link workers will have access to System 1 or EMIS, etc. So they can actually pull out the relevant bits of the record and also record in so the GP can then see what's happened and if the person's turned up, etc.